We'll get started. My name is JoAnna Harper, and I'm a clinical pharmacist who specializes in pain management. So I see patients pretty much all day long. So what we're going to talk about today is CBD, medical cannabis, and we'll just lightly put it as herb to make our lives a little bit easier right now to cover everybody in the room and their questions. I wanted to name this Being Blunt. I was overruled. And then my next option was Up in Smoke, and that did not go over so well either. So the cannabis conundrum, there you go. We're going to go through today recognizing the difference between hemp and marijuana, looking at the differences between indica and sativa, knowing the difference between CBD and THC, looking at the endocannabinoid system and exactly where these things are working, looking at different products, dosing, and especially side effects, what we know and what we don't know. Looking at safety concerns and things that you need to look into before trying some of these medications. We're going to talk about kratom. I don't know if anybody's heard of kratom, but that was a hot trend last year, and that's one I want to at least have the safety concerns out there. Discuss the legal and social concerns associated with cannabis, and then talking about applying wellness and lifestyle techniques as far as looking at all conditions, so scleroderma being one of them, pain being another, but looking at it from a lifestyle approach and not just one drug as my answer, because there is no easy button in life, as much as I try to find that. Okay, a little bit about me. So I've been part of the foundation for the last 20 years through school, so on and so forth. I'm a chronic pain pharmacist working with physicians, and so I'd be seeing patients just like a physician does. I just concentrate on the medications and the wellness approach versus diagnostics. And been a patient advocate for many years. My entire goal is to empower patients to become active members of their healthcare team. And as you can see, my daughter comes with me every year. Right now, thank goodness, Paw Patrol won over, so you do not hear her in the background. And most importantly, I am a scleroderma patient. I've been diagnosed more than 25 years, so I went through pharmacy school looking at all of this from the perspective of a patient first. And how is that going to mean to us as patients individually? So I'm in there with it, y'all. So when I talk about we, it really is we. And I'm also a chronic pain patient. Okay, I have nothing to disclose except I cannot keep my mouth shut. So I'm a little blunt. I try to tell you exactly how it is. I don't have any involvement in industry at this point. Everything I'm providing here is for educational purposes only. Please, by no means, take this as medical advice. Okay, always talk to your physicians and your providers, your pharmacists at home, and have an actual conversation about all of your medications. I am available. My information will be at the end to answer some basic questions, and I will stay here for a little bit afterwards. But I am not licensed to provide personal medical information or medical advice in every state. I only have 4 states available, so I apologize for that. But I am available for any other basic questions. The history. So, the history of cannabis has been around for a long time. The first documented use was actually in 2737 BC, for rheumatism being one of them, on cave drawings, actually. I did not get a picture of the cave drawings. If I do this one next year, I will guaranteed get a picture of these cave drawings because I want to know what that is. But even going so far as the Irish physician early on in 1839 noticed that there were some medical benefits associated with this. In 1887, we saw some benefit with neuropathic pain. And then in 1925, the United States decided to ban it. For a lot of political reasons, and even though I can't keep my mouth shut, I am still going to try to maintain the property or the proper use here with the video. That being said, I'll see what I can do. So we did find the cannabinol structure in 1940. We found the THC structure in 1964. And we discovered the euphoric effects in 1967, leading into the 70s, and fun times, right? In 1978, in 1978, we had looked at the Controlled Substance Therapeutic Research Act that allowed us to study THC and cannabis as a medicinal purpose. So the concern with that is yes, we could study it, but the strains that we were allowed to study were back from the 60s. And so it wasn't until 2016 that researchers were allowed to use the more current strains that we have. So the data that we have that says it's not efficacious, we're using strains that are the potency, about 10% potency of what we use now. So that's part of the problem in this situation that we're in right now with the medical cannabis. But in 1996, California was the first medical marijuana state. And then in 2003, the World Health Organization recommended that THC be scheduled as a Schedule 4, which is pretty low on the totem pole there. Oxycodone is a Schedule 2. And that basically tells you how addictive it is as a property and what the concerns are for the society as a whole. So as far as legality, so federally, it is still a Control 1, meaning there is no medicinal purpose. So that's right up there with cocaine. With each state individually, though, they can determine what they want to do as far as making it legal and what levels of legal do they want to go. So looking at, we do have 4 state territories in 34 states that are legal for medical cannabis. And for each state, they could determine what that meant. So for instance, Minnesota, where I'm currently residing, there are 2 places that you can get it, and they have very few products. So they've regulated it to the point where, that's the regulation that they wanted to have with it, but there's also drawbacks, such as cost and availability. And then there were some states who decided to do a low THC, so they wouldn't allow the red products or the really high THC products. And those are listed here, so you can look for your state in the list. And then the recreational marijuana states are starred, so Nevada being one of those. Minnesota is definitely not one of those. So when we look at the actual plant and getting to understand really what do all these terms mean, so cannabis is just the genus of the plant species. So it's that one subset of plants. So it kind of covers all of them. And then when you go one step below that to species, that's when you get into hemp and marijuana. So there are over 70 species of cannabis at this point that we know of. And the differences really are, so the hemp products tend to have, they were originally designed for industrial purposes, so fibers, clothing, things like that. And there is a CBD over the counter with hemp in it, and we'll talk about that as well. But that is generally a cannabis sativa. So, and we'll go through a little bit more of what sativa, but it has to contain less than 1% THC to really be part of that category. And then marijuana itself, again, medical and recreational uses associated with this one. It is the one that's more psychoactive, and that's cannabis indica, and that can have anywhere from 1 to 30% THC, so a really big difference in the 2 products. And if you look at the picture, they look very, very similar. So when it comes to legalities and staying within the laws of your state, they look awfully similar. So I would know the concerns associated with that, and that there can be confusion very easily. So sativa is red on the left-hand side, generally tall and slimmer plants. That's where you get that head high, and then alertness and euphoria, and then increased energy. So that's usually daytime use, preferably. And then indica, as the many of the shops I have visited, couch is what they call that. Shorter plants, but really it's a relaxation. It's an appetite stimulant, pain relief, and really it really is that body high. And yes, without the video running, I can tell you, no, I have no experience with this stuff. Best for nighttime use for this one. So the endocannabinoid system, interestingly enough, this has been around for a long time. We didn't start thinking about this until the 90s, which makes me a little nervous. But CB1, so what we do know about the endocannabinoid system is there are a lot of functions that we just don't understand yet with the cannabinoid system. There's CB1 receptors in the central nervous system, the lining of blood vessels, which is what we're looking at for scleroderma as one of those. Within the stomach and the skeletal system, within the bones and the tendons. And so we're looking at fibromyalgia with CB1, we're looking at multiple sclerosis, and potentially bone growth. So there's a lot of interest right now in whether this product would be viable for osteoporosis. Now, I can't tell you with medical data it is or it isn't, but we'll talk about the safeties, and then we can weigh risks versus benefits at that point. And then there's the CB2 receptors, and that's really the immune system. So the endocannabinoid system has a lot more to do in our body than what we even know about yet. We're just at the tip of the iceberg right now. And that is part of the central and peripheral nervous system. We're talking about Crohn's and rheumatoid arthritis for that one. And then we do talk about, with CB2 receptors, the tachycardia and orthostatic hypotension that can occur. So when you see in these slides CB2 activity, those are the things that we're going to watch out for, is a rapid heartbeat, and then feeling faint when you stand up. So cannabinoids as a class, so that's the actual molecule, there's 568 unique molecules in cannabis. So when we talk about, we don't know a whole lot about this yet, we're barely scratching the surface with how many molecules we know, let alone what each one of those do. So in the cannabinoids themselves, there's 60 that work in the endocannabinoid system, CBD being one of them. So CBD has usually no euphoric effect associated with it, and it's used for pain and inflammation. I usually use this for patients who have more of an inflammatory response, that I want to calm down that inflammation in various parts of their body. And we will go into further details about the products as well. And then the tetrahydrocannabidiol is the THC, and that is the most psychoactive. And I will tell you, for personal experience as well as a number of my patients, it's best to start at the lowest possible THC product. Because it really is psychoactive. Some people tolerate it a whole lot better than others, but in the grand scheme of things, I always want you to start slow, or start low and go slow. So, but we do use THC for decreased nausea and to increase appetite. So generally speaking, the rule of thumb right now is that the CBD with the THC is actually better because it has a synergistic effect. So some of those products that are in between that have a little bit activity of both tends to be more beneficial than one product or another. But we'll talk about specific products. So if you look at the structure of CBD versus THC here, if you look on this left-hand side here, the only difference is that ring is broken. So that's a minute difference in my world. In the body, it's actually a big difference. And so, like I talked about, CBD alone reduces inflammation. It has antioxidant properties. It has shown to decrease seizure activity. So we'll talk about one of the medications that just came out recently. Antidepressant and antipsychotic. It can decrease IBS symptoms. There is some talk and some research being done right now about reducing tumor effects. And 30 different metabolites that we've found. So when CBD breaks down, it breaks down to 30 different chemicals. I don't even know what those do. So, a lot of safety concerns that we'll talk about. And then on the other side, THC, that is really more used for nerve pain, so that tingling, numbness, especially with like diabetes or peripheral neuropathy. It's used for decreasing muscle spasms and relaxation, used as a sleep aid, and as well as glaucoma. You know that, I think Puss in Boots even had it in his, it's for my glaucoma. Anyways. But THC has CB1 and CB2 activity, which will become important as they do more research on these. And if I thought 30 metabolites was a problem, THC is over 100. And now the problem with that is some are active, some aren't. So when you first take the medication, you get the first pass effect, and then if there's an active metabolite, you'll keep getting effects, which that may be good or bad, depending on if you like them. Okay, so in Minnesota, at least they are color-coded, and I'm hoping other states at least get into some type of consistency with all of these, but so black is the highest THC in Minnesota, and then violet is more CBD. But every time one of my patients goes to the medical cannabis pharmacist, they're given a yellow and a green, and then a red. So I'm not quite sure what education they're getting, but we will just say I do a lot of talking about this with each individual patient. Because the higher THC products do tend to have more side effects. And so some of my older patients, it is challenging, and they don't like those effects. So it is something we have to watch out for. So some of the available products out. So Marinol has been around for a very long time, or Dronabinol. Sometimes your provider can get Marinol covered on your insurance for an appetite stimulant as a workaround to getting this covered on a traditional plan, but it's usually for weight loss or nausea and vomiting. And oftentimes it's used in HIV and other wasting type diseases. It does work on CB1 and CB2, and we do know the metabolism of this one, so we know what drug interactions are gonna happen a little bit more so. And then Sesamet, I'll tell you, I don't have any personal experience with that one, but it is another available product. But interestingly, the only information I could find was metabolites are known. Right up there with CBD for me. The newest one out is a Pidiolex, and that is actually a CBD product it's a cannabidiol for 2 childhood seizure syndromes, and that's what those are. So we're getting there as far as the FDA and the approval, but the problem is they're picking more obscure conditions right now, especially those that are targeting children. But that one is mainly CB2 associated with that one. So here's some of the new promising medications that are coming out. I know Corbus out there. I think somebody from Corbus, raise your hand right there. Any product questions or any other things, I would go to her directly because I'm not privy to such information. But they do have one coming out, I think it's phase 3 trials right now, looking at the medicinal benefits for systemic sclerosis in particular as one of theirs. So I think that that's very helpful that we do have the information out there for scleroderma and that we do have Corbus on our side on that one. To be able to get the data and be able to really find and study the benefits of these and allow it to be more mainstream. There are a bunch of other products in various stages as well. My goal to show you this is just to let you know that there are options coming. And as we know, everything needs to go through checks and balances. And really we're looking at safety and we're looking at efficacy, and we want to make sure that this is the right thing for you before it goes to market. Okay, so routes of administration. Important things here, oral, so there's a variety of different oral products. There's oils that are actually the most potent but also the most expensive. And those are generally pure products. And then you have tinctures. Tinctures they usually have some type of alcohol in them, and it does dilute them. And oftentimes that dose is easier to give yourself and less possibility of taking too much. And we do have the edibles. So I know California and Denver are great with their edibles. And so that's mixing the cannabis, whether it's CBD and or THC or a combination of the two, into like little gummy bears or candies, things like that. There is oral sprays available as well as lozenges. So just for instance, it is very, and I'll go through a little bit more of this too, but it's very important in your state to know what your laws are. I have a very good friend of mine. His son has really bad anxiety, and let's just say we are not a recreational state. But his 18-year-old is looking at a felony charge right now for carrying around an oil. So definitely important for you to know, what's going on. And then the topicals. So there's creams and suppositories. So suppositories are still topical in the sense of the anal canal. With any type of topical, my biggest concern is where is the pain? What is causing the pain? Can this topical go deep enough? These are very small molecules, so the absorption I'm not worried about. I know the absorption is there for most of these products. The systemic side effects, so what goes through your entire body, is much less than any oral product, which I appreciate. I would rather you treat the spot more directly if that's what you're going for pain relief. Or you just have one fussy joint. I would rather you take care of that one joint rather than the whole body. But with the creams, if it's a deeper joint or a deeper pain, it's going to be harder to get to that area with a topical product, and that's just being real. And inhaled, so that's the smoking or the vape, it is very, very fast acting. So we're talking, 2 to 4 minutes to start feeling effect. And, it really starts working well. Well, it's 5 to 10 minutes to start working, and then 2 to 4 hours. My patients tell me it's more like 2 hours, depending on the product, versus oral, which is, 60 to 180 minutes. So you could wait 1 to 3 hours to start feeling the effect of the oral products. So the disadvantages with the smoking, as I hope we've learned here at these conferences, is putting anything into your lungs that it's going to have a vehicle to get it into your lungs. And it's that vehicle that I'm concerned about. It's also, our lungs are not, that the tissue within our lungs is very, very sensitive. And so my concern would be, what is the damage that we're doing later and what's going to happen from that, as far as you just need to know the long-term effects as well as the short-term effects. And then obviously the topicals depend on a variety of different things, including skin thickness, so it may take longer with our skin. Okay, so dosing. Most importantly, start low, go slow, and stay low. Bigger is not better on this one, okay? I do recommend low THC products initially. So the products that are more CBD dominant, I prefer those. You get the anti-inflammatory properties, number one, but also less psychoactive effects, so less side effects, less fogginess, less dizziness associated with it. When you have the non-medicinal, go to the dispensaries, that's what I'm talking about, herbal here. Usually it's 1 to 3 grams per day is the usual dosing. Very rarely do we see more than 5 grams per day. I don't know about somebody else, but I do know there was a number of scleroderma patients in the past, and that good friend of mine was not able to be here this time. I am sure he's in one of those higher groups. But it's not generally recommended, as far as we don't know the long-term effects with heavy use, and we don't know exactly what it does. But start with one inhalation every 15 to 30 minutes. If you're more sensitive to medications, I would wait more like 30 minutes to an hour to really see the effects. So it really isn't the personal experience doing 5 before you get on a plane, okay? It was a very interesting plane ride. but that was halfway through it. So at least I made it to the airport. CBD, there are no established guidelines. So we have very little information on the products that are available over the counter. So the Farm Bill passed last year that allowed CBD from hemp to be over the counter. And so the problem with some of these over-the-counter products with CBD is we don't know the purity and we don't know the concentrations. So from batch to batch, is it the same product? 1. 2, is it the same concentration? And 3, what really is in that? And so when I recommend products that they verify testing from a third party. So each batch that they make has to be verified, and they have it available. They should have it available on their website. You check the number on the bottle, and that number on the bottle is what tells you your exact batch, and you can look at exactly what was in there, okay? That's what I recommend when it comes to the CBD hemp products. And I'll tell you, for instance, my state, Minnesota, does not recommend pharmacists be involved at all. Of course, obviously, I don't follow rules well, so I will gladly give everybody the information. But really, generally speaking, these are sold by people who have no medical information. And if anybody's been to the medical dispensary, some of them I felt the same way. And I can't say I've been to all of them, but I will say that I've been to a few of them across the country. And sometimes I feel like I'm on my own. And I'm sure some of y'all feel that way too when it comes to the products that are out there. So we'll talk about that a little bit more as well. It may take months to find the right combination of product. So the right amount of CBD versus the right amount of THC, the right amount of dosing, exactly how much do you need, how often do you need it, and what does that mean for you? And then with medical cannabis, the goal really is, once we get a little more coordinated with our efforts, is really having a pharmacist talk to you about it. And having that ability to speak to a pharmacist about these medications, and then also educate the medical field a little bit more about the pros and cons with these medications. And really, just because the time associated with FDA approval, which we all know can be a very lengthy process, what else is available in the meantime, and what does that mean for you? So education really is the key. But being forceful about our recommendations to our providers can be difficult. So titration, here's just a few examples. Depending on your state, this goes along that same, start low, go slow type idea. Really, I would go with the smallest dose available that's measurable, and then work your way up from there every couple of days. So I would give yourself 2 days on each dose, and then go on to another dose later down the road, a couple of days later. And then once you find the dose that works, you may have to alter that depending on the situation, depending on what other medications you're on, if you're on an antibiotic, so on and so forth. So there's a lot of things to consider here, and it also depends on food and bioavailability. So side effects, CBD side effects. As you can tell, THC is a lot more side effects than CBD. CBD, there can be nausea associated with it and changes in mood, which I have seen actually in some of my patients, and same with irritability, which I find interesting, especially with people over the age of 65. And then anxiety. You'll see anxiety on both sides, and same with nausea. So although it's used to treat anxiety, it can also trigger anxiety too. So things to watch out for. So that may not mean that you don't, if your anxiety increases after you use it, don't use more. It can be a side effect. And then THC, so the big things that I'm concerned about, I really have seen hyperemesis. And yes, it's used for vomiting. But I've had some people who, even with just one dose, cannot stop vomiting for days. And again, I don't know exactly what product they have. I don't know exactly how much THC they had. All I know is they took the cannabis and they were vomiting for days. So precautionary there. Dry mouth, for those with Sjogren's. Dry mouth is real, my friends, with THC. I will tell you that is probably the worst thing for me, and that's one of the reasons that I choose not to use the THC products personally. There are a lot of conversation about confusion and decrease in IQ with the higher THC components, because really the people back in the 70s who continue to use, and that's perfectly fine, a lot of times the products they're choosing are the low potency THC just because that's what they're used to and that's what they're growing. But what's going to happen when we have the higher THC products and we're using them regularly? I don't know the IQ effects, I don't know the memory effects, and I don't know if that's leading us down a path of more Alzheimer's, more dementia. We don't know yet. And so those are my concerns for my patients, my loved ones personally. And then hallucinations, those really are real, and I have seen them. I have not personally, but I have seen my patients have them. Euphoria is another one that actually can be a benefit depending on where you're trying to go for that moment. But one thing that I'm really concerned about with THC is vasodilation. So yes, it does vasodilate your core. The problem is if it has to vasodilate your core, it takes your blood from somewhere else. And my friends, that is your periphery. Those are your fingers. And so we've had cases of Raynaud's patients who have severe Raynaud's attack for a couple of days that didn't end because of the vasoconstriction associated with THC. So again, higher potency products, avoid those until you know what they do for you. There's a question about decreased sexual abilities and really what that's going to mean, whether that's desire or actual function. I have seen a decrease in both in some of my patients, so it is going to be something that we need to research more. And same with acute pancreatitis. So if that's something you're prone to, you might want to stay away from THC altogether. And then, with THC in particular, withdrawal symptoms are real. And I don't know exactly to the extent that withdrawal symptoms can harm. I know with alcohol, it can kill. With opioids, it sucks, but it's not going to kill you. I don't know where THC stands. So just cautionary. So every state can determine what conditions that they want to approve it for. This is Illinois, and man, they like their medical cannabis, it appears. Minnesota has, I think, 10. Oftentimes, physicians can find a way, usually anxiety, weight loss, wasting, any type of, most of the things that we have, or chronic pain, oftentimes those are covered under medical cannabis. So that is something to have that discussion with your physician about. So contraindicated, so ones that I would not use it for. Pregnancy, obviously, I would hate to harm a child. I know in the 70s it's happened a lot, but with the higher potencies, I am concerned about that. And same with breastfeeding. They are small molecules, like I said, so the amount in breast milk can be pretty high. If you already have schizophrenia or psychosis, probably not beneficial to keep that up or to contribute to that at all. If you have active addiction, so if you're chronically using meth or cocaine, this is probably not a good idea. And for most states, that is a contraindication to getting approved for medical cannabis. Metabolic syndrome, so this is interesting. I saw studies on this, and I've seen the papers as far as the concerns. So if you have high triglycerides or diabetes or obesity, there's a cautionary concern there. It's not contraindicated. I wouldn't say this paper called it contraindicated. What I would say is monitor that very closely. So if you have hypertension, I would monitor your blood pressure after using some. See what it does to you. And use the same product each time. And then for us in the room and with scleroderma, big caution with immune compromising drugs. And so that's a lot of us. So we do know that it does work on the immune system, and it may compromise it. So that's something that we don't have enough data yet to prove otherwise, but it is something to watch out for. If you're worsening while using THC or CBD, that's something that you're going to want to consider stopping that for a while to determine if it was that product. And then serious heart or liver disease. I will tell you, liver disease, all those metabolites are broken down by the liver. And so we kind of need that to break these down. And if not, you may just be high for the rest of your life after one puff. For some, that might be beneficial. Just kidding. Okay, so question, is cannabis addictive? So there was a study done as far as where cannabis lies in the addiction category. So on the bottom, it's physical harm. So, and then on the top, it's dependence. So how dependent on this medication are you going to become? So obviously, heroin and cocaine, highest amount of harm, highest amount of dependence. Okay, and you start coming further back down. And interesting, buprenorphine is in the middle, which is what we use for addiction. But we're moving on. And then cannabis still has a good amount of dependence associated with it. So whether that's addiction per se or dependence, that could be a physiological dependence too. So your body gets used to these chemicals. So my concern as an individual and as a provider is this dependence going to lead down the same path as we had with the opioids, meaning, our bodies become dependent on them, our bodies adapt, they change based on the environment it's given. And I know what happens with the body with opioids now because I have 3 million people to study. I don't have that many people on high amounts of THC, so 10 years down the line, is that going to be the same concern that the body has now adapted because we don't understand the endocannabinoid system well enough? So is the body going to adapt and make new receptors and then give us bigger issues? I don't know. Okay, as far as dependence, they talked about 19% of the people became dependent on marijuana. Okay? When you look at it, tobacco is 32%. So yes, it's less than tobacco, significantly less than tobacco. And I would take marijuana over tobacco if I made a recommendation. But again, the smoking aspect, I think, is the one that I avoid. But the most important thing here to consider, for those less than 18, when the brain is not fully formed yet, that risk increases by 17%. So now we are getting closer to heroin when it comes to medical cannabis, and so, or THC. And so that's where my concern lies is, again, we don't know enough to really know exactly what's going to happen. Okay, so the other concern is marijuana use disorder. So anytime that we have any product, we want to watch for any safety concerns, any things that are going to crop up to see if there's going to be a bigger problem. So if you're using larger amounts over longer periods of time than you intended, that's a warning sign. That's something that we need to consider. If you are unsuccessful and you want to cut down or control your usage and you can't, if you spend your entire day trying to figure out how to get it, how to use it, and how to feel better after using it, okay, we might be going down the wrong path. If all you can think about is the cannabis, if your social work, recreational activities are decreasing because of it, if it puts you in a dangerous situation, or you continue use despite medical or psychiatric harm, okay? Classic signs of addiction there. So things to watch out for with this type of product. So drug interactions. This is one of the most important pieces for me as a pharmacist. We don't have enough data, and that's my concern. I can tell you what I know right now, and I can teach you about that, but as far as what else we learn further down the road, I'm hoping next year I will have a more robust set of data to provide to you. There are the CNS depressant effects. So if you combine it with benzodiazepines like Xanax or Valium, alcohol and opioids, there can be significant sedation associated with that. There can be mania if you take it with an SSRI, and that's an antidepressant. So that's Prozac, Lexapro, any of those, and potentially even duloxetine, which I know a lot of people use for pain management. There can be a fast heart rate or delirium if you take nortriptyline or amitriptyline. So those are all considerations. And then we talked about the immunosuppressant properties, especially with corticosteroids. So if you're on prednisone, are we going to suppress your immune system even further in a negative way? And if you're taking antipsychotics, it may counteract the effect of those. And it does have competitive metabolism. So that means if you're on other medications that use these same enzymes, which we'll talk about, there could potentially be drug interactions. And so they're going to compete for the same enzymes. And unfortunately, CYP3A4, I believe, covers 80% of the drugs that we have out there right now. And that's a big list of drugs that can interact. So the interactions I talk about today are only the most severe and the most inhibiting or inducing. But there are a list of hundreds and hundreds of other drugs that are also going to compete for that same enzyme to break down. So if you have two drugs that use that same enzyme to break down, say maybe CellCept, that needs to be broken down for your body to get rid of it, and you have the THC that needs to be broken down as well, the more THC you use, the less enzyme this drug has to break down. So potentially you could have a higher amount of CellCept, for instance. So there's a lot of different things. We don't have data on really what those numbers look like, or even whether CellCept is a big issue or not, because we don't have the exact percentages, but it is a consideration. So medications that can increase the CBD and THC. So the ones that I want you to be concerned about here, cimetidine or Tagamet, cyclosporin. So these can all, if you're taking cyclosporin, diltiazem, erythromycin, fluconazole, the fluoxetine, grapefruit is another one. So it's the same interaction as grapefruit, interestingly enough. Ketoconazole, itraconazole, those are the ones that I've seen most often, or verapamil with scleroderma. That can increase the amount of THC and CBD. So even if you use a small THC product, a product that has limited THC in it, that can mean that these drugs have made it to where that's a big amount of THC. So again, something to watch out for. Ones that can increase THC. Again, the amount of THC you're going to get is higher if you're on, say, metronidazole for an infection. The other ones that I've seen, clopidogrel is another concern, and Depakote, and sulfamethoxazole, so Septrum DS is another one. So antibiotics, things that we need to watch out for. So if suddenly you're on this antibiotic, you're doing fine on your THC, and then you start your antibiotic, and somehow that high now just became 10 times worse, or now it's into mania, it really probably is that antibiotic that caused that. But that does not mean not use your antibiotic, for the record. Okay, so meds that increase CBD. So CBD is the one that's available over the counter from hemp. Plavix, another one. Tagamet, another one. Nexium, the esomeprazole. That's a concern. Fluconazole for any type of yeast infection. Fluoxetine for mood. Modafinil or Provigil. I know some people take that here. Omeprazole is another one that I would be concerned about. So just know that the amount of CBD you're getting could be a lot more. So the ones who don't get any effect from THC, they could be on some of these drugs. So basically these drugs are now making it to where your body is eating up the THC to where you don't really feel the effects. And that's phenytoin, St. John's wort, or Tegretol, or Bosentan. So Tracleer for PAH. And the meds that decrease CBD, so those patients who are like, CBD doesn't do anything for me. Could be concentration in all fairness, but it could be some of these medications too. So again, St. John's wort, and then phenytoin for any type of seizures or other conditions And then any type of barbiturates, so phenobarbital, I've seen used sometimes. Oop. Okay, so medications that decrease THC and CBD. So there's different enzymes that break each one down, and different enzymes have different drugs associated with them. So the ones I'm worried about here is, again, the Tracleer, the Provigil, and phenytoin is another one, and St. John's wort. So I'm going to keep going back to that one because that one interacts with almost everything I have. And then medications. So going through kratom. Has anybody heard of kratom? Okay, has anybody used kratom? Okay. It is a natural product. I respect that. I am a naturalist by heart. I only went to pharmacy school because nobody could tell me as a kid what the Scleroderma drugs would do to me. So I had to figure it out myself. Unfortunately, though, this is a messy form of tramadol. I don't know if anybody's tried tramadol, but it works on serotonin, norepinephrine, and as an opioid. And so this was kind of everybody's workaround. Well, if I can't get medical marijuana, then I'm going to get kratom. The problem is if I thought the products that are being used over the counter were a little sketchy with what's in them, kratom is even more sketchy. And so it does block serotonin, norepinephrine, and dopamine, even at very low doses. Those are neurotransmitters that you need for mood, you need for functioning, very important neurotransmitters. So it can cause anxiety and agitation and increased blood pressure. So things to consider. It often includes an opioid compound. So with the opioid epidemic, again, I would still rather have that real conversation with your provider than go down this route. So there was a significantly increased risk of suicide with kratom. And then serious death and adverse events have happened with kratom, so I do not recommend kratom for any reason. Okay, important tips. I actually feel like I'm somewhat on time. Okay, there are concerns for our fellow Scleroderma friends who are below 18. Again, the brain is not fully formed. I don't know exactly what's going on. But again, it's a risks versus benefits. Having that conversation with your provider to really figure out what that means. Try CBD first. Just a CBD product from hemp is what I recommend first. But I recommend one from a company that is independently tested, that they can guarantee that they have tested each batch. Each batch is numbered, and you can look at that testing and say there's no other impurities. It is the concentration that it says it is. So there are two that I have vetted. I have no financial obligation with either one of these, but Plus CBD is one that I have found to be reputable, and that was available at one of my local Fresh Time market right down the street. So that's what I found that's commercially available. If there's one that you are interested in and you can't get that information, email me. I'll be glad to look it up for you, okay? But if you ask whoever's selling it, whether that's the co-ops, whether that's the health food stores, they should have that data for you because this is coming. So for the state of Minnesota, I think federally what they're trying to do is mandate it to where there has to be a barcode on every bottle that it has CBD in it to guarantee it. So in order for it to be over the counter, it has to have less than 0.3% THC. But of course, the federal government can't regulate that as much as they would like to for the 3 million companies that have cropped up in the last year. Okay, THC can be very difficult to tolerate initially. So just caution, start low, go slow, and stay low. THC can increase anxiety and nausea, as we talked about. Please communicate with all your healthcare providers. I can't stress this enough. I understand that there are many healthcare providers who are not as open with this conversation. And if they're not open and, absolutely insist on no, I would either A, look into another provider that you can at least have that conversation with, Not every provider has to say, yeah, gung-ho, this is fantastic, but at least finding one who will have that conversation with you as far as what are the risks for you independently, especially psychiatry. I can't stress this enough with how much depression is involved in scleroderma. I don't want to trigger that any further if we can avoid that. Okay, and keeping your rheumatologist in the loop. I know everybody's becoming a little more open-minded. I mean, come on, we're at 34 states now, right? So it's getting there, but we're not quite there yet. But communicating is your best tool, and talking about the pros and cons, having that real conversation. There is so if you have a drug abuse history, avoid it at all costs. I would even avoid CBD personally if you have active meth addiction. Look at your state laws very, very carefully. I cannot express this enough. Minnesota has a state law, and same with Wisconsin. If you are pulled over for driving, and they don't even need a reason necessarily to pull you over, they can take a urine drug screen, and if you test positive for either opioids, benzos, or marijuana at all, any metabolite, then they can give you a DUI even if you were not driving erratically, okay? So most states have these types of laws, and I will tell you, opioids, for instance, stay in your system usually 3 days. So you can take one dose every 3 days and test positive every day, okay? Depends on the sensitivity of their test, but I don't know about you, but I don't like personally sitting in the back of a cop car personally. So know what the laws are. Know what the laws are about traveling. So even if you are a medical cannabis card holder, you usually cannot go to another state, even if they are a medical state, because they are medical for their state. Now, are they going to bust you for it? I don't know, but I don't know about you, but I don't want to tempt that. You cannot travel across state lines via air travel, via your cruise lines, things like that, and definitely not overseas until you know exactly what their laws are. I will say that TSA does not look too kindly on it, and there were two grandmothers, I don't know if you've heard, but they were carrying CBD from hemp, legal, as of last year, in Disney World, and they were not so kindly escorted out of Disney World for having CBD from hemp, okay? So there's a lot of confusion about hemp versus marijuana, okay? Don't share, don't sell, don't give away your medical cannabis. It really is a drug. It might be a natural drug, and people tell me, well, I can't overdose on this. And I will tell you, the story I give is, if any of you have seen the Vincent van Gogh and painting Starry Night, right? The lights have halos over everything. It's because he was overdosing on a plant that he was eating on his salad, okay? That plant very well could have killed him, by the way. So, it really, there is an overdose possibility. I mean, there are still risks with heavy use. The goal really is if you're gonna do medical cannabis, to wean off something else. Wean off a benzo, wean, your opioids, like Xanax, clonazepam, oxycodone, hydrocodone. The goal is to find a product that's going to be used more effectively to treat whatever your condition is more effectively rather than masking it. And benzos and opioids both mask. Vaping and smoking not recommended for lung health. I try to avoid that altogether for all my patients. Genetics do play a big role, and we are finding with pharmacogenetics that there is a big concern when it comes to genetics. And so you might not metabolize THC well, and you could be one of those that is a slow metabolizer and one hit will last days. You don't know. Many drug interactions, and again, back to the limited data. So with pain management, my biggest concerns and takeaways, assess the source of the pain, and same with scleroderma, assess the source. So for us, it's an immune response, right? And it's an inflammatory response. Treat it as directly as possible. Use all available options, even with medical cannabis or, marijuana. physical therapy, occupational therapy, mindfulness approaches. I cannot express how powerful your mind really is. And so usually what I recommend is using some of these products to get a little more stable, start learning more tools that you can become empowered to do it without the need of a medication. Now, I'm not saying stop your medications, because I think they'd all hang me outside. But what I'm saying is the ones that are using to treat symptoms, how do we decrease those so that we can decrease the possible side effects? And sometimes opioids are more appropriate than cannabis. I have those times, and I will tell you that I have those patients where I say opioids are more important or more appropriate. Every patient should be treated individually, so what you take may not be the same thing that your friend takes, and what works for your friend may not work for you, and that is okay, because our bodies are completely different. Even though we have scleroderma, we have a lot of other genetics that are playing in here, and a lot of other medications that we're on for other conditions. Hormones and metabolism errors can resemble pain and fatigue and anxiety. So some people may not be able to break down folic acid as a genetic problem. So there's a lot more to it. So I look at it from addressing the root cause, so looking at potentially a functional medicine provider, and seeing if there is another reason for some of these symptoms, including some of the scleroderma symptoms, addressing an inflammatory diet, and stress contributors. So how do we decrease stress in an effective manner that may not have long-term effects? The paintoolkit.org has a bunch of videos and resources that you can use for pain and anxiety to help take control and to help ask questions to your providers about what you want to know more about. YouTube really is our friend. And I mean, you know, there are reputable sites that you can use to get good information on how to do mindfulness and how to do meditation to some degree, even if it's just a minute a day. And then the other options, I don't want to forget the low-dose naltrexone. I actually use low-dose naltrexone for my patients for pain and other rheumatologic conditions before I would use medical cannabis. And if you want to know more about that, I can give you all the information on that. But it does use different mechanisms to decrease your body's inflammation and to increase your body's own endogenous opioids and potentially an immune modulator. I use different combinations of drugs using gabapentin, duloxetine, and an anti-inflammatory. Don't underestimate the power of buprenorphine or Butrans for pain management. And then topical versus oral, like I talked about earlier. If you can treat one joint, if you have one area of pain that you can point to, I'd rather you treat that than treat it through the whole body. And then overall focus on wellness. So I really wholeheartedly believe in the integrative approach to healthcare as minimum necessary requirements for long-term wellness. So when I talk about that, you know, I'm talking about, you know, diet, exercise, sleep, mental health. It all plays in together. All aspects of life contribute to your health. So I really can't stress the mindfulness approaches. And if you want more information, I'll be glad to give it to you. And same with exercise and therapy. So whether that's, you know, psychotherapy, you know, counseling, or whether that's physical therapy and movement and exercise, it's all very, very important. But I have no magic pill. I have no magic wand. I would love to give everybody a magic wand to make everything go away, but I can't do that. So finally, start low, go slow. May take months to find your effective dose. Start with CBD from hemp first, and then move on to cannabis, depending on your state laws. Use products that have third-party testing, and I gave you the two names there, Medterra and Plus CBD, but there are many others. Look at the benefits, pros and cons, talk to your providers. I have no easy button, minimal data, so we don't know long-term risks, so I would not say, yay, medical cannabis for everybody, just yet. So what I'm saying is, let's be cautious, use this as one of our tools that we have in our toolbox, and use it to manage your life most effectively in the most integrative way possible. And last but not least, please, please, please be an active member of your healthcare team. If you have issues with that or want other questions, I will be more than happy to help with that. So that being said, thank you for attending my talk, and let me know if you have any questions.